Now we have a talk from Alex Harris from the Medical Research Council. So Alex joined the UK Research Councils in 2008 and has since held positions in both the Science and Technology Facilities Council and the Medical Research Council. In 2013, Alex was appointed at the MRC International Strategy Manager. And in this role, one of his responsibilities is that of national contact point for Horizon 2020 health challenges. So let's all welcome Alex Harris.
Brilliant. So thank you very much, Flora. And what an inspiring video. So as you've heard, as Flora has already mentioned, my name's Alex Harris, and I work for the Medical Research Council, where I'm International Strategy Manager. And one of my roles is that of UK National Contact Point for the Health Demographic Change and Wellbeing Challenge that sits within Horizon 2020. Now, I've been tasked within the next half an hour to provide an introduction to Horizon 2020. And I plan to focus in on the Health Demographic Change and Wellbeing Challenge, which is a specific program within Horizon 2020. But I'd perhaps like to begin by taking a quick poll. So please could you raise your hands if you have had previous involvement in an EU research-funded project? Okay, so quite a few of you and quite a few newcomers as well, which is excellent. And I was briefed as such by Flora. So as I said, I would like to, I will begin by very briefly outlining the Medical Research Council's role within Horizon 2020. I'll then talk or show one slide to highlight the UK's success rates within the FP7 Health theme. And FP7 was the predecessor to Horizon 2020, and the Health theme was the predecessor to the Health Challenge that sits within Horizon 2020. And I'll then explain a little bit about what Horizon 2020 is, go over the three-pillar structure to Horizon 2020, and then, as I said, I'll home in on the Health Challenge, which I imagine is where the vast majority of the funding opportunities would lie for you guys, for the audience within this room. And then I'll finish by just talking a little bit about the National Contact Point support structure and what NCPs can do to help you. Okay, so the Medical Research Council, the MRC, has three main roles within Horizon 2020. First and foremost, we are a participant. So the Medical Research Council has units and institutes up and down the length of the country, as well as in sub-Saharan Africa. And the researchers within these institutes have proven themselves to be very successful at securing EU funding, and we would hope that will continue into Horizon 2020. Secondly, and perhaps obvious by now, the Medical Research Council also hosts one of the national contact points for the Health Challenge. That's me, I'm Alex Harris. I should also specify that I'm merely one of two national contact points for the Health Challenge, the other being a colleague called Dr. Octavio Panas, who's actually hosted by the Technology Strategy Board, and his focus is more upon SMEs and industry and engaging them with Horizon 2020. But I'll come back to the NCP support system later on. And thirdly, and perhaps most importantly, the Medical Research Council leads the UK Programme Committee delegation. And so essentially the Department of Business Innovation and Skills, BIS, has invited the Medical Research Council, delegated the responsibility to lead from the UK's perspective within this Programme Committee. And the Programme Committee is essentially the forum through which member states are able to input into and amend the core topics within Horizon 2020, and ultimately has responsibility for signing it off. Okay, so as I mentioned, FP7 was the predecessor to Horizon 2020, and this slide clearly highlights the top member state beneficiaries of the FP7 Health theme, which was merely one program within FP7. I should also highlight that these figures are not entirely up to date. They are accurate as of November, at which point there were still a few grant agreements which remained to be signed. So these bars by now are in fact a little bit higher. And I should also highlight that through the health theme previously and the health challenge in Horizon 2020, the European Union is able to provide support in a way which national funding agencies are not able to do so. So that's namely funding for large-scale, multidisciplinary, collaborative, international research projects, which demonstrate an EU-wide added value. So it's not simply a competition for member states to try and secure as much money from that EU pot as possible. However, having said all of that, as this slide clearly demonstrates, if it were a competition, the UK would beat Germany, it would beat France, and it would beat all of the other remaining member states. Now, the reason I'm showing you this slide is twofold, really. Firstly, to highlight the amount of funding that is available through the EU. As I said, this is just one programme within FP7. And secondly, it also highlights that the UK biomedical research base within the UK is extremely strong. And for that reason, we're very competitive when it comes to securing EU funds. And again, for that reason, we should continue to engage with Horizon 2020 in the way that we did previously with FP7. So, what is Horizon 2020? Essentially, Horizon 2020 is the European Union's research and innovation funding programme. And in a nutshell, that is what it is. It is simply the mechanism through which the European Union funds research. And Horizon 2020 forms a key part of a number of European policy initiatives. Perhaps key, or most of all, it forms a key part of the Europe 2020 strategy. And that is essentially the European Union's strategy for growth. I think it would be fair to say that the European Union, as well as the Merkels and the Camerons of Europe, have accepted that there is a link between science and innovation investment on the one hand with growth, jobs and competitiveness on the other. And that's reflected in the €80 billion budget that Horizon 2020 has. So that's from 2014 to 2020. And a key reason as to why the European Union was able to secure such a large budget when all of the other programs were decreasing in their funding. So for comparison, FP7 had a budgeting of just over €50 billion. It's because the European Union was able to emphasize this link between growth and jobs. And what they've done is to integrate the program and focus on not only basic research, but also innovation, so closer to market activities. And they're all combined within this Horizon 2020 umbrella. And also another key feature of Horizon 2020 is that it has been simplified in comparison to its predecessors. So FP7 was often criticised for being the funds were quite difficult to access. So the European Commission has made a concerted effort to try and reduce the administrative burden, reduce a lot of the red tape that prevented access for a number of participants, or potential participants. So Horizon 2020 has three main priorities. First being excellent science. So Horizon 2020 is dedicated to funding excellent researchers to conduct excellent science, and that's key. And as I mentioned, there is this focus on innovation, so closer to market activities, and that's reflected in this second priority of industrial leadership. And this is where support will be provided towards assisting industry, small and medium-sized enterprises, in developing the technologies, etc., which underpin innovation. And the third priority is that of societal challenges. So Horizon 2020 is dedicated also to addressing the concerns shared by the citizens of the European Union. Now, these three priorities are reflected in this three-pillar structure. As you can see, excellent science, industrial leadership, and societal challenges. And within each of these pillars, there are a number of oval shapes, and these oval shapes represent specific funding programs. So I'm not going to go into all of them in detail, but I'll provide a brief introduction to them. So the European Research Council will continue under Horizon 2020, continue to provide grants for researchers, so individuals, principal investigators, to build their own teams, set up their own laboratory, in order to pursue high-risk, frontier-driven research projects. Very importantly, the European Research Council has no thematic restrictions. So quite simply, the excellent project ideas put forward by researchers with proven track record, will be supported. The Future and Emerging Technologies pillar is again focused on basic research, but it funds collaborative research projects. So essentially, it funds kind of wacky ideas, really. An example would be a research project which is dedicated to communication with coma patients. So it's high risk, it's visionary stuff, it's not going to happen in the next few years, but imagine the impact, imagine if it could be achieved. Marie Curie grants provide grants to researchers, again, for training and career opportunities. So they provide funding for doctoral students to go and conduct research outside of the UK in another EU state, and also provide fellowships for experienced researchers to do the same, and then come back to the UK and bring with it the knowledge they've gained and the best practice they've learned. The research infrastructures pillar, so research infrastructures would be things that researchers need to access in order to conduct their research. So facilities, services, so examples would be CERN perhaps, or the Diamond Synchrotron in Oxfordshire, or high-powered lasers. And Horizon 2020 will provide funding to develop these and open them up to the EU community. Now, don't be put off by the industrial leadership pillar. The focus here is really upon industries and small and medium-sized enterprises, but there will be opportunities for the rest of the community to collaborate with industry in order to further develop the key enabling technologies which underpin innovation. So things like ICT, and there's a big emphasis on that. Space as well, there's a space program. But also nanotechnology, advanced materials. So there are core topics which relate to, for example, nanomedicine therapy for cancer, or advanced material, or biomaterials for the treatment of Alzheimer's. Perhaps another key difference between the excellent science pillar and the industrial leadership pillar is that the industrial leadership pillar, the European Commission sets the agenda, and applicants have to respond to those priorities set by the Commission, unlike the excellent science pillar, which is all investigator-driven. Now, the science societal challenges pillar, there are no surprises there, I don't think. So things like climate change, environment, and transport, food security. But the area which I believe, I would imagine the vast majority of the opportunities lie for you guys would be at the top here in the health, demographic change, and well-being challenge. And this is the area for which I'm national contact point, and I'm going to go and talk a little bit about the health, demographic change, and well-being challenge now. So what is the Health, Demographic Change and Wellbeing Challenge? First of all, it has a budget of nearly €7.5 billion, and it will operate with a challenge-based approach. So what do we mean by that? Essentially, the European Commission has set an overarching challenge, or a goal, if you like, which is to improve the lifelong health and well-being of all. So quite a significant task. What the Commission has then done is identify specific challenges or specific problems that it would like the European Union community to address. Now, in comparison to FP7, it's a lot less prescriptive. So the European Commission has quite simply outlined the problem that it wants the community to address. It has not prescribed the way in which it needs to be addressed. The hope is that this will allow scientists to be innovative in finding the most impactful solutions to these problems, and it's the most impactful solutions that will receive funding. Very much a continuation with FP7 is the collaborative nature to the health challenge. So in order to apply for funding, you need to respond to the challenge that has been addressed by the Commission, and you will need to submit an application, and in order to do that, you will need to be a member of a consortium. Now, that consortium must comprise a minimum of 3 independent legal entities from 3 different EU member states. Now, once you have your 3 partners, you are then free to have as many project partners as you feel is necessary in order to achieve the project's objectives, which is essentially to address that problem identified by the Commission. And the Commission is very much firmly of the view that in order to address these challenges are so great, they're so significant, that it will require a multidisciplinary approach. And by that, of course, I do mean a range of academic actors, a range of academic disciplines coming together. There's a particular focus within the health challenge, not only on biomedical researchers, but also social scientists, as well as ICT. ICT plays a key role. But it's not only about researchers from the academic community. So small and medium-sized enterprises will play a key role, and this ties in with this focus on innovation. In fact, it's worth bearing in mind that 20% of that €7.5 billion figure will probably be allocated to small and medium-sized enterprises who will form parts of these consortia. There's a strong focus in the health challenge in bringing actual benefits to patients. So that could be in any format, perhaps clinical guidelines and the development of drugs, interventions, therapies. So it's also important to potentially have regulatory agencies involved in the consortium. And last but not least, patient groups as well. Patient groups will be fundamental within these consortia. So in December of last year, on December the 11th, the European Commission published the Health, Demographic Change and Wellbeing Work Programme. So what is the work programme? A work programme is essentially a document. It's a document which lists topics arranged by calls, which call for your proposals. And by applying to these call for proposals, you can receive money in order to pursue your research project. When the Commission published this work programme, it published the call topics that will be open in both 2014 and 2015. The deadlines for the call topics in 2014 have now passed. The deadline for the call topics in 2015 have not passed. And within this work programme, there are two calls, and the topics are within these calls. The first being personalising health and care, and this call is kind of the main call within the work programme. As you can see, 34 topics, 15 in 2014, which have now passed, 17 are open for applications in 2015. And the decision to focus on personalising health and care was informed by the ageing population of the European Union, as well as the increasing burden of both communicable and non-communicable diseases, as well as the inequity between health and care systems across the European Union, and it's all about sustainability of health and care systems as well. The second call, coordination activities, it's really all about coordinating activities of member states, the researchers within member states and national funding agencies, such as the Medical Research Council. And there are 16 topics within the coordination activities call. So what I'm going to do now is go through the personalising health and care call. Personalising health and care call is then in turn divided into 7 different focus areas. So I'll go through the 7 different focus areas, and it will also highlight the titles of the call topics within this first work programme. So first focus area is all about unravelling health and disease. So call topics which relate to risk factors, understanding disease, systems medicine approaches. Second focus area is all about disease prevention. So you can see call topics which relate to translating omics data. You can see the vaccine, it says call a topic which relates to establishing platforms for vaccines for TB and HIV. So you can see we've moved from understanding disease through to disease prevention, now on to disease diagnosis. So core topics on in vivo medical imaging, about calls which relate to clinical validation of biomarkers. Then move on to disease treatments, so therapies for non-communicable diseases and rare diseases, regenerative medicine call topics. Then we move in, perhaps moving towards from basic research through to more applied or public health areas. So now we're moving into advancing active and healthy aging. You can see call topics which relate to service robotics. So how can robots assist the elderly in order to allow them to remain within their homes and live independent and healthy lives? The next focus area is all about the citizen, and the citizen being in the centre. So you can see here citizen engagement and M-Health. So how can mobile phone technology, smartphones and iPads assist individuals in empowering them to manage their own diseases? And again, a bit more on citizen in the centre. And then the final focus area is really all about understanding big data. And then the final call, so moving on to the second call, coordination activities. I'm going to have to speed up, I believe. So in addition to the opportunities which can be found in the work programme, there are also these strategic research initiatives, such as the Innovative Medicines Initiative, the European and Developing Countries Clinical Trial Partnership, and the Active and Assisted Living Programme. So these are strategic research initiatives through which the European Commission seeks to leverage both funds and knowledge. Very importantly, the call topics relating to these initiatives will not be found in the work programme. They're semi-autonomous, so you'll have to visit their websites in order to identify potential funding opportunities. Innovative Medicines Initiative is really all about, so it's a public-private partnership whereby large pharma and industry put in, I think it's just over €1.5 billion. The European Commission then match fund this with another €1.5 billion, which will be made available to academics, regulatory agencies, patients, organisations, in order for them to collaborate with Big Pharma in order to address the bottlenecks in bringing drugs to market. So it's all about accelerating the drug development process. EDCTP is all about funding phase 2 and 3 trials, all about sub-Saharan Africa. And again, its focus is on developing drugs and vaccines for malaria, HIV, and TB. And I think I'll gloss over the active and assisted living program and just talk a little bit about the National Contact Point support structure. So in a nutshell, and it was a nutshell, that was Horizon 2020. As you can appreciate, it is vast, and numerous different funding schemes can be quite difficult to navigate to identify opportunities. And for that reason, the UK has a support structure in place, national contact points, of which I am one. And we're here, much of what we do is raise awareness and dissemination activities, so coming to events like this. But more importantly, we're on the end of the telephone, on the end of emails, so if you have questions, if you have a project idea, you want to see whether there's potential opportunities within Horizon 2020 for funding, we can help you with that. We can also provide assistance on the rules for participation. It's a whole world of rules which I've not even touched upon today. So we're there to help, and I'm perfectly happy for these slides to be made available afterwards. Here are my contact details. I mentioned Octavio, the other national contact point for health. His contact details are here too, so feel free to give us a ring, send us an email. And again, these slides will be made available. I'll just highlight the participant portal here. This is kind of the main source of information online. This is where you can find the work programs, find the cool topics, where you find the rules for participation, where you submit an application, should you choose to do so. Okay, so I think that's me. Thank you.